Hello, hello. I'm going to give everybody a few seconds here. I just wanted to start early and make sure that everybody can see me well. And I think you can. Perfect. Look at that. My first YouTube Live. Thank you for joining me. Hi, Carol D. Oh, this is cool. It's live time. Oh, this is so much better than other platforms I've used. Bear with me for 2 seconds here. Wasn't sure if there was a bit of a delay today. Carol, since you're here, can you tell me you can see and hear me okay on the other end? Let me know if that's the case. And I'll get my rambling started. Awesome. Thank you, Carol D. So for those of you that have never joined me during a live before, today's a little bit different. Many of you are maybe seeing me for the first time. Many of you are coming to me from one of my groups. So I wanted to do just a very brief introduction. And I also wanted to talk about the technology at a little bit of a higher level today. So my name is Deb Pelche. I have been specializing in vibration plates for the better part of 2 decades. And I, like many of you, got into this whole shaky machine business because I had a health issue. I was just about 30 years old. I had blown my knee dancing at a Christmas party. I was always a bigger girl growing up. But I just couldn't be active like I had been in the past. And unfortunately, I was told I was old and I needed to lose some weight before I could get a partial knee replacement done. And I didn't necessarily seek out vibration plates as a way of losing weight. When I got into this, there was no eBay, no Amazon. And really what existed was the original medical grade devices from a lot of the research. So my history, I got on the machine. I tried one out at a local person's home. I thought for sure this is crazy. I got on this machine and I did this mean squat, and much to my surprise, the next day, I sure felt it in my thighs and my butt cheeks, but my knee was fine. So my curiosity, I was very fortunate to get a personal experience on one of the 2 machines out there that probably holds about 95% of the research in the market. That first plate was a vertical moving platform. I am certified internationally with a company called Vibrogym International. Many of you may know their former name, which was Power Plate. So I'm very versed with Power Plate, its history. I've owned 4 of their medical grade devices in my studio back in the day. But as the market evolved and as things changed, there was these home machines starting to come out at the mall, and Hubby and I were in our studio doing our thing, and other machines that moved different ways started coming out. And I remember trying, for those of you that know I'm from Canada, I was at Bower Lane Mall in Red Deer, and I got on this machine, and the guy was all put out because you had to plug it in. And I tried my first oscillating platform. Now, oscillating, linear, they're different movement types. And to confuse things further, they have lots of different names within each category. So the first thing we're going to talk about today is a little less Debbie in my history. Fast forward 20 years, I've had the good fortune of being in this industry long enough that I saw it, evolve from those medical device machines to what you may see mastering for sale today. There's lots of different brands that I work with. There's lots of different brands I recommend. Today isn't a sales pitch. I simply want to give those of you that are using a platform, considering using a platform, maybe you're selling platforms and you're a trainer or a therapist. I want to give you some basic understanding about the technology. There's probably one machine here that many of you have seen and are familiar with. Many of you work with some of the consumer brands that I do training for, so you may know my face that way. Many of you have probably never seen this before. So what I wanted to do today finally was have the chat, the vertical versus oscillating. What are the differences? And I'm going to start very confidently in saying they're both very safe. In 30 to 40 years of research, using machines much more powerful than what's being sold mainstream. Nobody's done more than over-exercise themselves and maybe been a little bit sore the next day. But without understanding what exercise fatigue or muscle soreness feels like, many of you using vibration plates for the first time are sore the next day, or your knees bugging you, or your back's hurting you, and assume it's the technology, when 9 times out of 10, you know what? You just haven't been given the benefit of a good introduction to understand how to use this thing that is sitting in your living room or your clinic or wherever it may be. So there are 4 main reasons that people consider vibration plates, in my experience. Health and exercise benefits is probably the most heavily marketed one. Whether you're looking at it for bone density, weight loss, you're just lacking time. There's lots of reasons people look at this as an exercise alternative. My experience is more about the second reason that I see people using machines, which is for symptom management. I have 2 very large support groups, one that is dedicated to what I refer to as fat disorders. There's much more technical names for it, but there's some pretty prominent conditions out there: lymphedema, lipedema, Durkheim's disease, all kinds of different disorders that aren't necessarily known by our medical community. But because vibration plates have a very big capacity to move lots of lymph very quickly, I'll talk about that more shortly when I get to benefits and a bit of shaking. That's the main draw for those types of conditions. Anything autoimmune, anything where you're trying to improve your lymphatic flow and movement, vibration plates have really been catapulted into the discussion forums, and this is what I'm using, and here's what it does. So symptom management, swelling, pain relief, anything that keeps you from, living your day-to-day the way you want to live it, anything that's holding you back from those activities. There's lots of different symptoms out there, and I talk about symptoms often. I don't like talking about conditions as much. Conditions don't have a preset group of symptoms. A lot of times symptoms can overlap conditions. There's lots of conditions out there that present in the form of pain. Okay. Feel good, relaxation. That's another big reason people like to use machines. Maybe you're using it as a recovery or a warm up for other activities. Maybe it's how you get rid of your day, your muscle aches, your pains. Maybe it's how you meditate. There's lots of different reasons people are enjoying the experience of vibration plate exercise therapy, whatever you want to call it, for the feel good benefits that you get out of it. Some of the biggest researchers I have met in the vibration plate field, people that work with NASA, all they can say after they get off the plate is, it just makes me feel good. It makes me feel happy. And you know what? Sometimes that's all you need to know. A lot of the benefits with vibration plates you will experience over time in using them. And the 4th reason people use vibration plates is to combine or enhance other things. So whether it's exercise, you're using it as a warm up, or maybe you've got a bad knee and it's kind of what you do to your knee before you go do your soccer or your baseball or your hockey game. A lot of my therapists will use it as a pre-treatment. A vibration plate in the clinical world, the medical world, is a catalyst. It better prepares the body for whatever you're going to do next to it. Big area of research right now, and many clinics have encompassed pre-stem cell injection, getting on a plate for a couple of minutes. Why? Because it's a logical thing. It makes you feel relaxed. It increases your circulation. It increases your blood flow. I have seen vibration plates at the dentist office. I've seen them in car dealerships. There's nowhere a vibration plate can't offer feel good and wellness benefits. What we're going to talk a little bit more about today is, as far as what we do on the plate, is there's a big line in the sand between the feel good and the symptom management stuff and what we refer to as fitness. So fitness, different moves, different dedication. But to get benefits with vibration plates long term, the biggest lecture I'm going to give you today is be consistent in using it. So If you only use it once a month, or you bought a machine and you get a 30-day trial period and it's the 29th day and you haven't taken it out of the box yet, you've got to give it a chance. If it was a medication, you'd give it 30 days because your doctor told you to, or your therapist. So for those of you that have a plate, are coming from a place of fear or misunderstanding, at the end of the live, and if anyone's curious right now, you can go to my main website, Deb's Vibe. And on the top right hand of my website, there's a little safety menu that'll pop down if you want to review my contraindications. So let's start with contraindications. And it's not what type of technology, although there are some nuances. The difference between the two, and hi, Vicki, thanks for being here today, is in how they feel. The benefits, in my opinion, long term, if you're using plates that offer adequate force levels, are very similar. From a safety perspective, the contraindications are universal regardless of what type of plate you're using. I have a really massive list, but I want to talk very briefly only on a couple. Contraindications are an indication. They are not a contra you cannot do. They are not a contra stop here. Contraindications, and if you've got something that is a contraindication on my list or somebody else's list, because there is no absolute list. There is no list of who's allowed to exercise and who's not. It's one of those depends situation on you, what condition you might be dealing with, what symptoms. Are you have you got acute issues right now? Maybe it's a moment in time. So contraindications are an indication to seek further clarity. Ask questions from someone more familiar with the technology or your body. So talk to your doctor, talk to your care provider, talk to somebody like me that's got experience, just so you can make a more informed decision before you move forward. All a vibration plate is activity. But because they accelerate movement and activity and the benefits you obtain from doing that, people tend to overdo it in one of two ways: too much time or too much intensity. And intensity, I will demonstrate. It's easier to explain that way. But you got a machine, it sets for 10, 15 minutes. You stand on it. It feels so good while you're on it. Why would you cut yourself off at 2 to 3 minutes? Well, if you're inactive and you haven't been off the couch in 10 years, you're probably going to overdo it in some way, shape, or form. So be conservative in your time. So before we get into plate types, the two contraindications that I want to touch on, the first one is blood clots, DVT, any conditions where you right now are aware that you have a blood clot in your system, or you are at very high risk of developing one. Does not necessarily mean you cannot use a vibration plate, but the approach you would take in using it, I want someone experienced like myself, like your doctor, guiding you, because what a vibration plate is better at than anything else on the face of this earth is giving you this massive rush of circulation, which can be so beneficial in so many ways. A machine is not a risk of forming or causing a blood clot, but if you do have one in there, we don't want the risk of it being moved because you've gone too long on your vibration machine and given your body more circulation than it's prepared or used to working with. So if you are dealing with DVT, there's lots of conditions out there where blood clot can be symptoms. If you're not sure if you have a blood clot, talk to your doctor. There's a blood test called the D-dimer that you can obtain, just to be safe if you've got a history. If you have a blood clot, you're exercising now, you're active. Some of this comes from, it really depends on your level of conditioning now. If I've got to teach you how to use the vibration machine and how to do a squat for the first time and, refer you to if you're changing everything at once, you want to be ultra careful and conservative and make sure that you have your health provider on board with you, holding your hand and making sure that you're making the best path decisions for yourself. Everybody's different. The other one that is a precaution that I get asked about a lot, but I do support and work with, is pregnancy. Pregnancy is also something that's usually on the top of most manufacturers' list. It's not a hard stop, so if I was like, I don't know, like a triathlete and I'm running and biking and swimming, 20, 30, 50K 5 times a week, do I just stop because I conceived and I got pregnant? No, your body's conditioned to this. This is what it's used to. But throughout the course of your pregnancy, you may need to modify your activities, the intensity of them, as you develop. If you are coming from a place of you've never used a vibration plate in your entire life and you've just become pregnant, it's not that there's any more risk, but you don't have experience. There's things you go through as a new user. The confidence in using this device, for the same reason you wouldn't, as soon as you get pregnant, decide to go take up, long distance running. You want to make sure the activities are appropriate and your body's conditioned for them. So pregnancy is really a maybe, and it really depends if you've got experience using. I'll add one more, maybe pre and post surgery. A lot of people, I can't use a vibration plate for 6 months, coming into my group of almost 18,000 people and telling me this. Well, why? Why can't you use a vibration plate for 6 months? Well, this site that sells them said so. Any manufacturer that has a list of contraindications is A, being responsible, and B, keep in mind, if you're buying a piece of equipment online through an Amazon company, even some of the medical devices, they're not necessarily there as your care provider. They're not your doctor. They're not versed on what you're personally dealing with. And you're asking them, well, is it okay to use my vibration plate after I've had a heart transplant? I don't know. It depends on where you're at with your recovery. There probably isn't a medical condition on the planet I haven't worked with at least 4 or 5 times, but it's in close relationship with your care provider, because it really is about where you are physically at in your health journey. So a vibration plate, the appeal when you're dealing with these type of conditions. Let's flip to benefits. And as I said, if you want to check my contraindications out, they are on my website. I will post a link here after the fact as well. But let's get into types. So whether you are using a vertical style platform, an oscillating platform, there are differences in how you can manipulate the settings for your personal experience. I will never provide you a cookie cutter chart where this speed or this frequency for this long is going to give you this benefit. It just doesn't work that way. But again, manufacturers are out there selling you quality products. They're making products. They're not there to be your HMO or your personal trainer. These are tools, and contraindications are simply offered as a guideline. They're not definitive, and that's sometimes why they'll vary between manufacturers. Some have less lenient or more lenient guidelines because they've got folks like myself or people that are experienced supporting their members. Companies that don't offer training and support generally have much longer lists. Children can't use plates. There's all kinds of different things on these because they're just not in a position to offer you the support you need to accommodate those type of users. So the first plate we're going to talk about, the movement style, is oscillating. This is a common plate many of you I know are using. This is a vertical style plate. Within each of these I mentioned earlier, there's lots of different terms. So oscillating is also referred to as pivotal movement, side alternating vertical. It moves like a teeter-totter, and it mimics that natural movement of walking across the floor. Oscillating was the first. It holds the most research, and it's still in a number of clinical trials as we speak. Any of the NASA stories that any of you have heard, no, there's never been a vibration plate on the space station. Anyone telling you that is stretching the truth. There were vibration plate technology components on the space station. The story, as I understand it, the treadmill on the space station, because you're in a zero gravity environment, makes the cabin bounce. And on certain vibration plates, there are what are called absorbers, and they're just little things around the feet that absorb the transfer through the floor. So there was vibration isolators on the treadmill, but there wasn't a vibration exercise platform on the treadmill or on the space station. However, the big story that most people have heard is, well, the astronauts used the vibration plates to improve their bone density. So yes, there's part truth to that as well when you're out in space in a zero gravity environment. our cardiovascular system. There's many things that start deteriorating. We as a human being walking around on this earth have a relationship with our planet, and it's 1G of force. So you don't feel it, but standing upright on the floor, you're resisting 1G of force. And essentially what vibration plates do in two different ways of moving is they superficially increase your exposure to gravity. And I'm not going to be a health expert on the benefits of gravity, but if you do any Googling on it or do a little bit of research, there's a number of benefits that we as receive in this relationship of exposing ourselves to gravity daily. When we sit too much or when we're in poor positions too much throughout the course of the day, gravity is still on our body. And, you know, over time, this is where the back aches or some of the things we develop being sedentary come from, because our body is exposed to gravity in a way that is not building the muscles. The muscles aren't resisting, the bones aren't staying strong. So on a vibration plate, how you are increasing your exposure to gravity is through two key factors. And regardless of movement type, and I'm going to break this down for each, so please bear with me. On an I always do that. On an oscillating platform, you have frequency. So frequency is how many times per second the plate is moving you. On a vertical platform, it moves you this way, like hopping. So how the plate moves you is different. And out of hopping. So how the plate moves you is different. And out of 10 users that I work with, 9 prefer oscillating movement over vertical. And I'm talking the research, the real machines. I'm not talking the watered down $50 ones that you're getting on the home shopping channel. Oscillating is more of a natural movement. It mimics how we walk across the floor, but with less impact. And there are studies out there about this. And it just feels more natural when you're on it. It's less invasive on the head. It is not harmful on the head, but it does take more getting used to. And as a trainer that has used both types side by side for almost 20 years, the advantages, in my opinion, that oscillating may have over vertical is you're kind of always having, your body is ever being challenged to keep itself upright. And it's that balance and stability piece that it hands down has a huge advantage on. I work with many things like instability, weakness, fatigue, and many of you just want to get more stable and more mobile. And even within the course of one session of using a vibration plate, you'll notice a difference. This is one of the things that many of them do at trade shows. So on oscillating, there's a little bit more to understand on the other factors. So frequency is how many times the plate is moving you side to side, or on a lineal platform, up and down. The vast majority of machines being sold today, the frequency is represented in speed, but it does not mean speed 1 is frequency 1. And I'll touch on that here in a minute. On this plate in oscillating movement, this is a combo machine that has 3 different movement styles. Oscillating, you can probably see it in the slow speeds on camera, but kind of moves you like that motion of walking. I want you to all go back to the playground when you were 4 and 5 years old. And if you were the kid in the middle, if you bring your feet closer to the center, you're not moving as much. If you bring your feet wide, you're moving more. And there's this mentality that's developed where, people get on these machines and they stand really tall and you can feel everything shaking in here. So it must be doing something. The guy selling these machines will tell you, oh, it's bad. It's too much movement. Look how violently it's shaking you. But if you listen to me first, and I was the first video you saw, and I said, oh, look how effectively it's shaking you. There's all these seeds that are planted in our head about these machines. And, it doesn't matter what I say or the study or the guy at the mall until you physically experience standing on one of these yourself. You don't know what your level of comfort is. But many of you think, why does more benefit? Because I'm moving more, and you stick it and you hang out here for 10 minutes and you let your teeth chatter, and and then you wonder why your knee and your hip and everything's sore the next day. First lesson with an oscillating plate is amplitude. There's also amplitude on a vertical plate. Amplitude is how much the plate is moving you each time. So if you're wide on an oscillating, you're moving more. If you bring your feet closer, you're moving less. So there's a little bit more understanding of how you, the user, are in control when you're standing on this thing. The frequency or the speed of the plate on an oscillating plate, they are much lower or slower than their vertical counterparts because they move farther. Muscles and a machine can only move so far, so fast. Okay? So I'm going to give you a visual on the ground. So whoever you are on the other end of the camera, we're in the park, and I've got a ball, and we're going to throw that ball. I don't have a ball here. Oh my gosh, it's not like me to not have a ball. We're throwing a ball back and forth, and we want to see how many times in a minute we can get that ball back and forth towards each other. So we get to a point, and let's say that we can do it 20 times in a minute. What if we want to go more times? How do we make it go more times back and forth? Well, one of two things. We can get super huge muscles and get stronger to be able to push it harder. That's probably not going to happen. Or we could take a step closer towards each other, reduce the distance that we're throwing the ball to get more times back and forth. On a vibration plate, your muscles can only move so far, so fast. And what combination of speed or frequency and your foot placement feels most comfortable or is your threshold is going to vary for every single person. It depends on the position that you're doing. And it really depends on your current experience using a plate. So when you're starting out on an oscillating plate or a vertical plate, see my trusty dusty stool, I recommend, if you are coming from a place of chronic issue, or you're dealing with pain, or you have something acute going on, take the body weight out of the equation. Have a sit on your stool and experience the plate, the speeds, the playing around on your first try with just the lower legs exposed. It's going to be a lot less scary. I want you to experiment. There are guidelines on, certain ranges that may be better for more, certain benefits, but the benefits truly are driven by the positions that you do on the plate. So when I'm standing or when I'm sitting, I'm getting some basics because I'm doing it on a vibration plate. Basic things like my balance is improving. You don't see it in my face, but my body is ever trying to counterbalance these little micro movements this plate is subjecting my body to keep me upright. So people will say, oh, my balance got better. I lost 20 pounds. There's lots of benefits that can be achieved just by standing here. But lesson number one, because common feedback I get is, oh, my dentures were bouncing around or my hearing aid was going crazy. Bend the knees just slightly. Many of you are going, bend the knees, bend the knees. If you bend the knees, you're going to feel the vibration, regardless of what style you're working on, suppress lower into the body. If you want to lose 50, 60, 70, 80 pounds, try squatting a little deeper and get the thighs and the glutes fired up. By doing a floor-based exercise on the plate, it increases the effectiveness of the exercise. It gives me additional benefits I wouldn't have received standing on the floor. And it substantially reduces impact on your joints. So anybody that tells me, oh, vibration plates are bad for joints, glue will separate, pins will fly out, none of that is fact. And anyone that comes into one of my groups or is coming into my live today with, I read this somewhere or I saw this thing, please give me the benefit. If I'm the one that you're asking to verify or validate the information, please give me the benefit of a link or a study. I'll rip it apart, guaranteed. I've been doing this long enough in 20 years. I've never found a reason logically for anyone not to use this plate unless it's a decision that their doctor and myself have decided that activity in general is just not up for you right now. So if you're able to be active, if you're able to get up around and make your sandwich and go to the washroom, you're bearing weight. So you should be able to use a vibration plate. How you use a vibration plate is based on your conditioning and the goals you want to accomplish. So for the first week or two, if you're a new user, just get used to how it feels. What feels good to you? What speed do you like? What don't you like? Play with the different movements if your plate has one. This combo plate has oscillating, which is 9 out of 10 machines being sold out there today for a reason. So if there's a listing out there and you don't see it says oscillating, it probably is oscillating. That's just the vast majority out there. Some of them are combo. This model has oscillating. It also has pulsation, and it has a third newer type, which is called lateral. Lateral doesn't have a ton of research. It's not my fave. It's not better for any one benefit, nor is pulsation. It really boils down to how it feels to you. And if you don't like how it feels, you're not going to use it anyways. Let's move on to pulsation before we talk more benefits. So pulsation is usually the second movement on the combi machines. What it's truly called, or should be referred to, is lineal. And the companies that are calling it pulsation, they're being very truthful. It's not really true vertical vibration. Vertical vibration back in the day, this is a plate that was actually manufactured in Canada many, many years ago. This company doesn't exist anymore. But this plate, verticals have faster frequencies. So the frequency range on an oscillating, best on the planet, is going to be up to about 30 or 35 hertz, meaning that's how many times per second it's moving. The amplitude is much larger, I mentioned, than the counterpart. So potentially this model, if you're like all the way out at the edges, you're moving about 8 millimeters. If you bring your feet closer to the center, you're more like 1 to 2. So you've got a range of amplitude. You decide how strong you want the movement based on foot position. You're always in control of oscillating. Oscillating always has variable amplitude because it's based on where you put your hands or your feet. On a lineal platform, the frequencies are much higher. And many of you out there perceive, well, it must be better. Look at the frequency. It's double what it is on the oscillating. But here's the difference and why you can't compare these. You can't put these side by side and set them on the same speed and say one is better than the other, because one is not better than the other. They are different, though. The difference on a lineal, vertical, linear, there's all kinds of names for this too. Triplanar now. Triplanar, that's another story for another day. Lineal plates have much higher frequency ranges. So they tend to be, kind of maybe the 20, more realistically 30 to 50 range, some as much as 60 or 70. They move much faster. But like the ball story I was giving you earlier, muscles can only move so far, so fast. So the amplitude on the vertical machines, the best plate on the planet, the most powerful plate ever built, put out about 4 millimeters. So on a setting of high, usually on a higher performing vertical platform, you'll have a high and a low button. So what that does is it switches on this, on the oscillating, you're in control of how strong or how far it's moving. On a lineal plate, it's a high or low button. So for those of you that are using linear plates, you may or may not have this feature. It may be a preset number. So most of them, the consumer grade machines, anything being sold on Amazon, any home machines, typically have one preset amount. So you can change your settings with frequency, but you cannot change the amount of movement the plate is generating. That's a preset factor. On the medical grade, mine back in the day had 2 settings. This has two settings of high and low. The settings are in the medical grade 2 millimeters on low and upwards of 4 on high. That's half of the amplitude in oscillating. So when everybody out there talks speed or frequency and all, this study was done this, but nobody talks about the amplitude. So when everybody out there talks speed or frequency and all, this study was done this, but nobody talks about the amplitude. Amplitude is the most under-talked, under-discussed factor that you need to understand. And it's particularly important in the vertical market. What has happened and why, in my opinion, after playing with these things as long as I have, there's lots of vertical style plates out there. There's some vertical feels more like what we would think of vibration, like you'd see from a massage gun. And it's because it's got higher speeds, but the amount of movement is less. So why is this important, Debbie? So when you're progressing with equipment, when you're training with equipment, the frequency of the machine and the amplitude combine to create what's called an overall G-force. So this is where this superficially increasing our exposure to gravity thing comes from. Now, the average home machine in the oscillating world is going to be probably top frequency is about 15 to 16 hertz. They do not offer the frequency range that the medical grade do. And they also have a couple less zeros behind their price tag. The downside of research in both styles of plates is a lot of the research out there is done on machines that none of you are using or are capable of reproducing. But does that mean that because my machine doesn't have the same frequency or the same amplitude range as the research, that I'm not going to get better bones or I'm not going to lose 20 pounds? Absolutely ridiculous. Medical grade vibration plates have done a lot of research, but they haven't researched every frequency, every variable on amplitude, every position, every type of user. No, they are not going to spend millions of dollars validating the machines that you're going to buy on Amazon for $300 to $400. Does that make sense? So they tend to showcase that frequency range. In oscillating, they tend to highlight anything above 18, 19 hertz. I will caution for those of you that are using medical grade plates, we'll speak just to oscillating for now. I do not recommend using high G-force plates that put out more than, let's say 7, 8, 9 Gs. So this is going to be your medical realm and medical price tag. If you're not working with someone experienced using that technology, it's probably not the first plate I would recommend taking home. I've been working with both consumer and medical grade for a long time, and the higher force equipment, there's a different stimulation, there's a different load in how it stimulates your central nervous system. And speaking from a place of personal experience, if you are dealing with neurological deficiencies and you're using a medical grade vibration plate, I suggest you work with a qualified therapist or someone else like myself before you pull out the checkbook. When you're dealing with plates in the up to 5, 6 G-force range, it's like adding weights. It's like adding more resistance. And what the faster movements with less amount of movement do is they allow you to exercise your body in a low impact fashion and get those muscles to fatigue faster. Are we stimulating central nervous system activity? I believe that we are. I have a lot of people that have paralysis, all kinds of weird nerve damage, and I'm experiencing improved sensation. I'm experiencing improved mobility, better neurological, better hearing, better speaking, better vision. So long term, I would encourage my research out there to look at other factors besides weight loss, besides bone density. Bone density, we'll get to benefits a little bit further, but I want to circle back to amplitude just a little bit further. So on a vertical plate, this one here is an example. This one has a preset of 30, and 50 hertz. And the amplitude on this plate is about 1.5 on low, and it's about 3 on high. Regardless of whether any of this up until this point has made sense, if you were to ask me one reason why vertical plates aren't everywhere and why aren't they as prominent as oscillating plates, I'm going to show you one thing. A true vertical plate is not quiet. It's just the way that they are. So why doesn't Debbie do more sessions on her vertical plate? What? Maybe that helps you understand. That's what 3 millimeters of amplitude sounds like. So here's the story. Years and years ago, as these plates started leaving the German research places and started coming to North America, they didn't put vibration plates in the hands of trainers or doctors or therapists. They put them into shopping malls and allowed you to experience them on your own. No instruction. And what happened in the vertical world is people didn't know. They wanted to see what this thing could do. So they crank it up to high. It's down, and it feels unbelievable in the head. It wasn't a pleasant introduction. So verticals, I honestly believe, had they been introduced properly, the salesperson had the benefit of some time using it before they introduced it to the people they're trying to sell it to, it might have had a different acceptance. Oscillating, it's not as scary. I don't. That's really probably not the best word, but because it more naturally moves like we do, standing tall with my knees slightly undone, yeah, my head's shaking a little bit, but it's not nearly the experience that the vertical plate is. So that's where a lot of this. So and in the marketplace, you've got manufacturers selling you equipment, and for years it's been, well, this one's better than that one, or this one's harmful and that one's not. And they pit themselves up against each other when there is no such thing as a bad machine. There's no such thing as a best machine. It's understanding two very basic things about them so that you can accurately compare. There's not a lot of research comparing vibration plates, is this benefit better for that? I mean, quite honestly, improving your body and making you healthier isn't as profitable as a prescription or having to go see the therapy office 4 to 5 times a month. So not unlike a treadmill, not unlike an elliptical, a vibration plate is simply a tool. It creates an environment that superficially exposes your body to an increased level of gravity that makes your muscles work a little bit harder. And for many of you that are unable to be active, or you've digressed to a point where the gym or even going for a walk just isn't an option, it's an absolutely viable, ultra low impact alternative to get you active again, or maybe it becomes your regular thing. It can be a therapy. So yes, for my therapists out there, what do I do for scoliosis? Well, what are you doing with your patients now? What exercises are you recommending they do at home? What stretches are you recommending that they avoid? The plate is just an environment that makes those exercises more effective in less time. What I will recommend, and I'm probably one of the few people out there, and I invite any conversation with any manufacturer, any researcher, any Facebook group, there is not one better than the other. But what I will tell you is if 100 of you lined up in front of these two machines right now, 95 of you would leave preferring this type of movement. But most people don't have that experience to bring to the table. I love both. They both have their pros. They both have their cons. But when it comes down to you investing in your living room for your family, safety, a basic oscillating moving plate is the best thing I recommend starting with. It doesn't matter what the benefit is, whether you're looking for bone density, better length, getting stronger. Again, what you do on the plate on the fitness side will drive those results. Most people I work with are looking for basic lymph management, improvement of that. They want to boost that lymphatic drainage. They want to increase circulation. So, you can use the plate from a therapeutic standpoint. The exercise, losing 80 pounds, recovering from a car accident, absolutely your therapist should be involved, but the plate can be a tool for a lot of those things you're supposed to be doing at home. For a lot of my special needs family, my other group I have is cerebral palsy for vibration for cerebral palsy. It's really more vibration for special needs. There's quite a mix of things in there, but I have a number of pediatric users. I support users as young as 6 months. I cannot stress how safe this technology is, but I have 20 years of experience using some of the most powerful machines on the planet. I'm trying to exude my confidence and my passion about these plates to you, and invest the time. If you've had a poor experience, if you're having an ill effect after you've tried the machine, you're sore, joint pain, it's not the machine. It's most commonly how you've used it. And one of two things: you've overdone it, or you've taken on more intensity. So more intensity on oscillating is standing too wide. More intensity on a vertical is that higher low setting. Back to the consumer world. The average vertical being sold today, unfortunately, even the medical grades of the past, unless you're spending about $9,000 to $15,000 on a vertical plate, and they're few and far between, the average $300 to $400 oscillating plate will offer more overall G-force. Now, you don't use max settings all the time, but as far as range to grow and progress, you've got all these little micro changes that you can make. You've got, in most of these cases, that 15 hertz is broken down into 60 or 100 speeds. So you can manipulate and change settings all day long. On a vertical plate, and this wasn't a cheap one. This one was probably about, I don't know, $2,500 back in the day. I used to own the medical version of this, but I mean, the thing was 40 inches by 40 inches square, and it sets you back about 12 grand. This machine is called a Wave. I'd like to give that plug to my good friend who invented the technology. But this machine doesn't exist anymore, and many verticals do not. Anything in a home vertical machine, the frequencies are accurate. And there's a reason many manufacturers only focus on frequency. Frequency, as I said, on a vertical one is higher. It's just the nature of the technology. There's faster frequencies, but less amplitude. The average home machine vertical is less than 1 millimeter of amplitude. They've watered the amplitude down to the point where it made it quieter and it felt better to the consumer, but the amount of movement has been reduced to the point where I personally have to question. There's therapeutic benefits, but you can't be making claim to a lot of the big benefits that the medical devices pushing 2 to 4 millimeters do. And what the amplitude does, think of your muscle and how far it's having to move and react to each movement. Well, 2 to 4 millimeters is a lot more movement than a millimeter or a half. Okay. Pulsation on the average home machine, frequencies are accurate. So on this model, I think it's got a range of 30 to 40 hertz, and there's a variable setting, but the actual amplitude is about 0.5. Okay. It's not the $20,000 counterpart. Now, the benefits are there, but I want people, there's this fight going on right now, and I haven't had this discussion in about 10 years. I don't know if it's the marketing or where this information is being generated from, but there's a lot of benefit to using a vertical plate. There's a lot of benefit to using an oscillating plate, and it's going to boil down to what you personally as a user feel more comfortable using. I by far prefer recommending an oscillating moving plate. It's going to fit more people's budgets. They're more widely available for sale. And in all honesty, there's different nuances within your house, what your neighbors are going to hear. A true vertical plate, many of them you will see more in gyms, gym settings. A lot of these big companies back in the day, went to the gym market, and that's where they put those plates. And some of those are commercial grade. They're built to take the abuse, but it doesn't mean that the guidance and the instruction is there. So I'm hoping to speak to those of you using vertical plates. As far as guidance and use, I will have more videos down the road on vertical platforms. But I recommend starting on a vertical plate in the lower setting ranges. And if you don't have someone at your local gym that can give you some guidance on it, maybe check with the machine manufacturer and see what they may have online. The moves, what you do on the plate, are universal, but the biggest things you've got to learn: oscillating, you're in control over the intensity, and vertical, if you're fortunate enough to have a better quality one, it'll have a high-low setting. If it doesn't have a variable amplitude, it's just going to be a preset amount. Now, how do I know all these factors? How do I know these things off the top of my head? Well, I'm very biased yet unbiased to the same degree. Amplitude is very easily tested on a vibration plate. All you need to do is get yourself a clipboard, a pen or a pencil, a nice big hunk of double-sided or duct tape to tape it to the edge of the platform. And while I haven't got this rigged up, but while it's moving, you can simply make a mark. It's pretty accurate, to be honest with you. Same goes with a vertical plate. Frequencies are a little bit harder to validate. Why would you want to validate them? Well, there used to be some manufacturers that overinflated their values back in the day. A lot of manufacturers are very truthful. I tend to support and recommend companies that are more accurate and truthful about their information in general. This little doodad is called a digital tachometer. Many of my mechanics would know exactly what this is. You'll use this to test the rotations on your motor on your car. I, ever cleverly, was taught there's a little shim that I'll stick off the edge of the plate with a piece of reflective tape, and I'll take a measurement on this, and I'll divide it by 60 to get me how many movements per second. So, which is also fairly accurate. I've been in this long enough. I've been fortunate enough to work with a number of engineering firms, with other companies that I've supported some initiatives, and actually taken this for independent testing. I'll never forget my first time in an engineer's office when I had to explain to them what this was and how to test it. It was pretty humbling. But yes, I've seen a number of older platforms validated by separate parties, engineers, and that's where a lot of these G-force calculations that are big math equations over my head. But a lot of my experience is through feel. I've been on so many platforms. I've owned, oh gosh, probably 50 or 60 different ones at this point. And I have a sense or a feel, sometimes the sound. But you as the consumer looking on the internet doesn't know the difference. So if you're looking for a recommendation as to where to start in this technology, I absolutely recommend oscillating. It doesn't have to be the biggest, fanciest model. There are just vertical plates out there, but push for those specs, guys. If they're not willing to disclose what the displacement or the amplitude of the plate is, why not? Because I can't find that spec on many websites. I can find frequency. We're very proud to brag about the frequency, but I don't hear a lot about the amplitude. And if I can't hear it in a video, I know that it's not producing very much force overall. So the lineal machines out there being sold, through the home shopping channels, some of these online ones through the online retailers, they might be hitting, a G or two of force. Based on my experience with some of them, you're still about half of what a $300 to $400 oscillating platform will offer. And in the long run, you're going to prefer the feeling of oscillating. It's just my experience, and I'm being honest with that. So next I want to move on to, where's my noteboard? Hang on here. If I haven't talked you to sleep yet, it's going to be brief. We're going to get into some doing now. Okay. I want to just double check here. I love the pulsations. Do you recommend a certain speed for osteoporosis? Okay. So I'm going to get into this. For those of you that are, and thank you for raising that question. I do not recommend, if you didn't watch me in the beginning, there is no speed or level or setting that is directly aligned with any one benefit. So let's get into some benefits. The benefits are absolutely everything you've ever heard and probably more. The benefits of using a vibration plate are the same benefits as exercise. So what are the benefits of exercise? If I really need to tell you, then you need to do some Googling. But the advantage a vibration plate has is for those of you that can't do traditional exercise. You know, I know your doctor's telling you got to do this and you got to do that. But I remember back in the day, I would like kneel down on the ground and my knee would lock up for 3 days. I can't go for a run. I can't go to the gym. Are you kidding me? Then you get into this pity party. So osteoporosis was the first point. Osteoporosis, anything bone health related, isn't about a plate type. It isn't about a setting, but it is marketed that way. There's a couple of companies that spent a shoot ton of money proving that, you know, bones improve at this or that. So they've got to market it. They got to get their money back out of that research. Bone density is about bearing your mass, bearing your weight regularly. And if you can do things that require those muscles to pull on the bone and work harder, you're going to get bang for your buck and you're going to get other benefits. You're going to get strength. Maybe you're going to burn some calories because you're boosting the metabolism. So why on a vibration plate, or why would I want to use a vibration plate if I'm dealing with osteoporosis? The biggest advantage with osteoporosis, and this is an advantage that oscillating, in my opinion, brings quicker than vertical. Osteoporosis, and everybody gets hung up on the bone density, and that's important, but that's a real long-term benefit. That's not going to happen by next Friday. For those of you that are dealing with severe osteoporosis, nobody ever dies of osteoporosis. It's the fall, the break, and the lack of recovery or the inability. So for me as the trainer, if your concern is osteoporosis and you're pretty, you know, progressed in that, you're dealing with balance issues. I want to get you stable and I want to get you solid. I want to build up your stamina. I want to make you strong. And guess what? By doing all those things, by just spending time on the platform and bearing your mass, your bones are getting stronger. The biggest bone density benefits I have seen have not been from the guys doing the big workouts with all the weights. It's my users that use it consistently. And who's using a plate consistently? It's my symptom management people, those dealing with, you know, backaches and pain. You're using it to relieve something else. And then all of a sudden you go to the doctor 3-4 years down the road and then look at your bone density and go, wow, it's increased. How is that possible? Well, you're bearing your mass on an environment that increases your exposure to gravity. Back to the beginning of my chat, what happened to those astronauts when they were in space at zero gravity? Their bones and their muscle mass deteriorated. So logically, even just standing, doesn't matter what setting, standing on this thing for a few minutes a day, where it's superficially increasing your exposure to gravity, you're getting more bone building exercise done than if you were on the floor. You're getting more circulation and more lymphatic movement than if you were on the floor. These little micro movements that the plate generate and your body, you know, stabilizes against, that's where those extra benefits come in from. So the advantage of using a vibration plate for a condition like osteoporosis is you're going to get stable. And I'm talking like within one session. Many of my therapists will use a vibration plate for just a minute or two prior to other therapies because it makes the patient more stable. There's less risk of falling. So if you are dealing with severe osteoporosis or any condition, and there's lots of them, where you have poor balance and stability, just spending a little bit of time, even if you're starting seated, you know, maybe you're doing a little seated and a little standing, is going to improve your bone density. Many of the studies for osteoporosis that are being marketed right now are coming from vertical manufacturers. So they're plugging that 30 to 40 hertz. Most combo machines have 30 to 40 hertz in pulsation mode, and you can use that, but you can also use oscillating. You can also use that lateral. Bone density is about bearing your mass. I'm suggesting oscillating because you also get the added boosted balance, the better lymph flow, the circulation, because there's more amplitude that we're playing with. And there's a number of studies out there that also show bone density improves at 12 hertz and 15 hertz. But you wouldn't know that's an oscillating plate. I do by the frequency they use. But when I hear, oh, everybody knows that bone density is only accomplished at 40 hertz. No, is that your opinion, or is that fact that somebody maybe presented to you? Because there's a whole range of studies out there on not just bone density, but it's not a universal movement type, and it's not a universal setting. But be fair to the manufacturers selling you to these things. They're not experts like me. They haven't been doing this 20 years. They want to give you guidance. So they're conveying information that they're seeing on the internet and is being marketed by many manufacturers out there at the base level. So it's not an inaccurate answer. It's just not the only answer. And I don't want anyone thinking or listening to companies that, well, it's going to hurt you. Oscillating is bad, or oscillating is not vibration. This is all nonsensical. You're not speaking from a factual place. Oscillating is the foundational movement. None of this other stuff would be here if this type did not come first. Vertical absolutely has its place. I love it. I invested a small house in it many years ago with my husband, but it's not the only option. It's the less preferred option, and I will back that up with 20 years of experience. I have both for different reasons, but all of my coaching in my sessions, vast majority in my groups, is on oscillating for a couple of reasons. 99% of you are using that type of movement or a plate that is capable of. If your budget is limited and you're just looking at a singular moving machine, 9 times out of 10, they're oscillating. So, and in my experience as a trainer, there's more functional benefit gains to be had. So that's why I preach it. Okay, and I started with vertical. It's not one better, one safer. This is nonsense. Put this all away today. What else? Common new user things. Okay. So benefits. We talked about bone density. Let's talk about strength. Let's talk about weight loss, because they tend to sometimes be the same thing. So to gain strength, what would you do at the gym? Would you lift weights? Would you take a class? There's lots of different ways to build strength at the gym. There's lots of different ways to build strength on a vibration plate. What you need to do as a user is do a little bit of goal setting. So if I want to tone the quads and the glute, and I want to drop 20 pounds, I mean, you'll probably get some benefit like this, but you'll probably get more benefit like this. And I touched on it earlier today. What you do on the plate to a degree drives the benefits. The plate is just a tool that creates this environment that makes those exercises more effective. Now, notice I'm not moving. I never did have that knee surgery, okay, first of all. But I do have to be careful. You can move on a vibration plate. There's nothing wrong. But for those of you and most of you that are dealing with joint deficiencies, arthritis issue, learn the positions first. So learn how to do a good squat. Maybe you need to work with a trainer for a little while, or a friend who does these things. The best thing you can do to improve your exercise benefits on a vibration plate is have good technique. So if you learn 2 to 3 moves and do them really, really well consistently, you can just use your settings to mix things up from time to time and keep the body in check and progressing. So I'm at about a mid squat. You want your heels planted. You can Google how to do a good squat. And you want to work within your own range of motion. So I'm just bending a little deeper. The chair is nice to have as a safety thing. If you're in a chronic place and you're trying this with me today, good for you. But maybe you find yourself in a position of fatigue and now you're done and you wish you would have stood up sooner. You can just sit back down on the plate or on the stool. So I'm on speed 1 on this plate. Biggest mentality that I would like to correct in this industry, I've said it several times, I would like you to start conservatively. I have never said I want you to start slow. But because nobody really understands vibration machines, and we think about treadmills and ellipticals and try to associate with what we do understand, we think starting at a slow speed is where we should be. But if you haven't been here for the last half hour ramble about amplitude, I prefer on an oscillating plate, especially if you're coming from a chronic user place, I want more functional. So feet no more than hip width apart, but bring your speed up a bit. This model has 60 speeds. Overall frequency is about 16 hertz on this model based on my tack test. Okay, so you're moving up about a quarter hertz each time. When I speak ranges, I know it drives my members crazy. I want you in a mid-range. So I've got 60 speeds. What's the midpoint? 30? Somewhere in there. 25 to 35. It's not an exact number. But if you get going a little faster, it's less choppy. It's less wobbly. On an oscillating platform, the mid-ranges are a little smoother. If you're dealing with a medical grade and you're talking high frequency, that's another session for another day. I want to speak to the masses today. The vast majority of you are working with a platform that puts out about 16 hertz. For those of you that are using a medical grade, if you're a new user, you have no business using more than that to begin with anyways. Trust me. So if this is something that's not terribly challenging for you, you go to the gym now, you're a little bit more active, I would like to keep your feet and the speed the same, but you can try standing, you can try squatting, you can try doing some pistols. Whatever exercises you do on the plate are generally driven by what you already know how to do. So if you don't know how to do any of these exercises now, this is the perfect program for bodybuilders, and this is the perfect program for MS patients. It really depends on you as an individual. You are not your condition. It does not define who you are. Your goals are your goals, and this just makes them possible, where other activity perhaps is just not. I hope that makes sense. So strength, bone density. For those of you that weren't aware, and I hope I've stressed this enough, lymph. When you move, lymph moves. So for those of you that are in my larger group, half of you are there because you just need help with the lymph. Let's get the lymph and the circulation, and just give your body a week or two, no matter where you're coming from, to get used to this technology, get your body assimilated to, and then start looking for more purpose in the form of a routine. And I have more and more of those appearing on my YouTube page every day. Skip forward about 10 minutes on any of my videos to get past the rant. Most of my workouts and what I prefer as a person, as an individual, I'm a very busy mom, I homeschool, I'm running around on any channel on Facebook that will hear me rave about these machines. So I'm very busy, and I like to get my stuff done quickly. I do HIIT style training where I do minimal positions. I make them really, really hard while I'm doing them, but I'm done fast. My actual play routine is probably no more than 5 to 6 minutes. And I like to use it throughout the course of the day I need an energy boost. What would that look like, Debbie? So one of the other benefits, and I would like to say it's probably the third benefit, is whole body vibration plates give you life. They energize you. That rush of circulation, that oxygen flowing through your system, it gets rid of your aches and pains. It dissipates lactic acid. So it just makes you move and feel better. Some of the common things when you first start out, when that circulation and that lymph gets going, is there's an itchiness, a pins and a needle. And many of you have posted questions in my group about that. Probably the number one common side effect, if you want to call it that, when you start using a vibration plate, it tends to be a little bit worse on vertical because the muscles are moving differently. But you get this itchy pins and needles. Some can be very severe and break out in literal hives. So as increased in circulation and lymphatic flow gets going, you got to ask yourself, am I in a position where my body's compromised and my body may not be able to move circulation or lymphatic as effectively as the average person? That would be a big clue to reduce time. Just because your machine offers a 10 or a 15-minute setting, does that mean you should go max time right off the bat? Give me a break. Start with 2 to 3 minutes. See how you feel. Do a couple more small sessions later throughout the day and see how you feel. One point I want to add, anyone dealing with a condition called MCAS, mast cell activation syndrome, some of you, not all of you, many of you experience kind of an elevated histamine response with activity, increased movement. It's not a vibration machine thing, it's an activity thing. But because we get more activity done in less time on a vibration plate, the symptoms of that elevated histamine response surface quicker. So if it's like crazy, insane level itch, hives are developing, it looks like you're having an allergic reaction, do you have MCAS? Or if many people find out they have MCAS because they tried a vibration plate machine with me and had this type of a reaction. So it's just something to plant a seed in the back of your mind. And if you are dealing with MCAS or suspect that you are, all the more reason to be conservative and do less time and less intensity. Other common new user things. So as you're shaking and you're churning, usually about 30 seconds to a minute in with most of my ladies, I feel like I gotta pee. That machine made me feel like I gotta pee. Or maybe you had to take a poop. These are all very good things. The machine doesn't make you feel like you gotta pee, but you are moving vast amounts of lymph. So guess it's gotta go somewhere. So if you find yourself up peeing 5-6 times that evening, the first time you tried a vibration machine, or you're rushing to the bathroom at the office 10 times during the day because you did your first session before you went to work, as you increase and your body becomes more effective at moving lymphatic fluid, it's got to go somewhere. So you might find yourself in the washroom more often than usual. Another reason to be conservative, if you're dealing with a compromised lymphatic system, maybe you've had some node removed, there's all, you've got savage varicose veins. All these things are reasons to reduce time and intensity. Most people follow the guidelines of the book that came with them, and they get on the machine really wide, and they go for 10 minutes on a slow speed, and then they wonder why their veins are popping out the next day and why they lost 7 pounds. My record at a trade show, one woman, 11 pounds over 2 days. That's how effective this can be at moving lymph. So all the other common sense stuff, drinking your water, yada, yada, yada. The itchiness, the pee and the poop generally will dissipate or level out within a week or two. So if you have been really itchy or really sensitive, and even if you've reduced time and I've done everything Debbie told me and I'm still itchy, it'll get better with regular use. Don't stop. Like I say, you're going to give a pill 30 days. Please give me that opportunity on your machine as well. Give it a chance. It's taking you 50, 60, 70 years to get to this point. You're going to try it one time and say, oh, it didn't work for me. It made me itchy. It's making you itchy for a reason. And if you've got toxicity, you detox as lymph improves and moves. Yes, there's detoxification going on as well. So all things that are good, but after about a week or two of consistent use, the itchiness, the pins and the needles tends to dissipate, may return if you're exposing, maybe you're getting down and putting the arms on for the first time, or you're sitting on it for the first time. Massaging, yes, you can sit on your plate, massage your bum, your thighs, range of motion required. But if you're exposing new body parts, the itch may return a little bit, or the pee or the poop might pick up again. And that doesn't necessarily mean everyone's going to experience it. If it's a problem for you, if you're constipated and you're not going regularly, you'll probably have a little clean out. If your lymph is really backed up and you've got chronic swelling that's been there 20 years, you're probably going to have more fluid move than someone that doesn't have a compromised system. So common sense to a degree. Another common benefit when you first start using a vibration plate is an increase in energy. So if you are experiencing that, and you normally are fatigued, or you're a user that's dealing with, pain or depression, and all of a sudden you're in a good mood and energized, don't go do a whole month's worth of house painting and grass mowing. When we get energized, especially my women, we tend to go do too much of other things. And then tomorrow morning, you're messaging me going, "Oh, Debbie, I couldn't walk for 2 days. That machine." Well, what did you do after your first session? Well, I felt so great. I went for a jog and I painted the neighbor's fence. Energy, especially those of you that are dealing with chronic issues, when you have energy, you do too much and you pay for it the next day. So please, if you are coming from a place of chronic fatigue, pain, and this is giving you relief, be conservative more often than long sessions. So use it for a couple, 3 minutes throughout the course of the day when you need it versus one big long session. Gain energy, because if you go too long, next benefit, I'm too tired. I use my vibration plate and I'm wiped out. I can't do another thing. Usually related to too much time, or again, too wide feet, too intense. But another reason I preach 2 to 3 minutes as a time frame, maybe it's a minute. See how you feel. Give yourself an hour or two. And if you feel the energy has been lifted, maybe that's your starting point. If you're feeling fatigued and drained, or you struggled to complete your time, the last thing I want to do is drain the energy you do have to get you throughout the day. The goal is, you'll learn this balance of how to use it to boost energy versus deplete it. And sometimes that's driven by symptoms or medication or other factors. But really the goal is 9 times out of 10 with regular use, you're going to start noticing it's going to be like your Mars bar. It's going to be that energy lift, that Snickers bar. That's one of the commercials. So it's going to give you that lift. Joint pain. So is it common to have joint pain after using a vibration plate? Well, not if you follow Debbie's How to Get Started video, but it is a common question I ask, and it's a common reason many of you stop using the plate and give up on it right away. Joint pain, is there a theme to my answers here? It's too fast, or pardon me, too long and too intense. So you're taking on more movement than that knee or that hip or something else should be taking on. Be realistic. Start hip width apart. And if it's still too uncomfortable, or bring them even closer. But if you're dealing with joint pain, you've got arthritic pain, you got bone, I've heard it all. I got bone on bone, no, I got torn meniscus, I can't do. No, it's just a matter of modifying what you do on the plate for the bad joint. For those of you that are dealing with joint replacements, you probably wonder why I didn't bring that up with my contraindications. Because it's not a contraindication. But if you've had a knee replacement yesterday, should you use your vibration plate in the same way you were using it? No. Does it mean you can't use it at all? No. You got to get creative though. So you've just had a knee replacement. Has your doctor told you that you're not allowed to move for 6 months? Probably not. What about the other side? It's doing double the work. So what can I do if I have, Deb, I really, I feel sluggish. My lymph is backing up, but I can't do anything with my new knee replacement. Well, can you do this? Can you put the replaced leg on the ground and put the leg that's not replaced on the plate? You could put a step beside it, or maybe you're seated. You can expose the good leg and keep the bad leg off the equation. There is no exact time frame when it comes to joint replacements. It really depends on the type of joint replacement or implant. This applies to anything from pacemakers to hip replacements to bone grafts to ocular impairments. Any invasive action on your body, your recovery period has been outlined by your doctor, your therapist, your optometrist, whoever's done the surgery is going to say, hey, I want you to wait maybe 2 to 3 weeks before you do any vigorous activity or high impact activity. This isn't high impact. We've already established that. But your experience prior to using this is absolutely going to drive and dictate your level of comfort using it after you've had a joint replacement. So if you're an experienced user, you already understand the foot thing. You know that speeds feel different. And you know logically, you know, if I just had my hip replaced, I probably shouldn't use it the way that I was, but I'd really like to find a way I can use it because I know it makes me feel better. So if you are dealing with a recent joint, any kind of implant, you have to follow and adhere what your doctor has outlined as your guidelines for activity. This is just the thing you're using to do your activity that's less impactful. What you do on the plate is driven by your goals. If you've had a bad experience, post hip, bad knee, you know, I've seen all kinds of things go wrong that way. And if you do need some custom hand holding, I have done a pre and post surgery video specifically, but 9 times out of 10, it's a matter of reducing the amount of body weight and just knowing what your own limits and parameters are on activity. And we just translate that to the environment. Less time, less intensity. So it's never a no, it's always a depends with me, because there's always a way to work around these things. If you are experiencing joint pain, you've either spooked yourself or you've taken on more than you're ready for. So reduce those feet in oscillating. If it's a vertical platform that you're using, reduce the high-low button. So go low. If it doesn't have a high-low button, put a mat on it. Let me get a mat. This is a very thick piece of yoga mat. So dampen it. Put a mat on the surface to help just absorb a bit of the vibration. You can use a mat on either style. A lot of this is personal stuff, your preferences, your sensitivities. You've got to experiment. And if you're quitting after day 1, you're not going to do a lot of experimenting. The last common newbie thing, and I could go on for 5 days because there's lots of other new things that happen to people when they start getting active again. But generally, you get more activity done in less time. So most people aren't getting to the point of fatigue or stressing those joints out if they're doing other activities because you quit long before then. Detoxification. As the body systems start moving and flowing better. I talked about peeing more. I talked about pooping more. These are all good reasons to use a plate. But sometimes it's a skin surface thing. You may notice swelling, you know, in joint, you know, when we exercise, many of you may not be aware of this, but exercise causes inflammation. For this tear and repair process that we hear, it's not a bad thing. It's just a thing your body goes through. Inflammation is a part of healing. It's a part of recovering. But if you've had severe swollen knees, elbows, you know, your neuropathy's through the roof, any of these things that have increased as a symptom after using your vibration plate, 99,000% of the time, it's due to too much time or too much intensity. So remember, you're dealing with a deficiency. Do not follow your manual. Follow my page. So the skin surface detox, you know, sometimes you break out some pimples here, the back, the face. You know, there's lots of different ways our bodies will detoxify. All the more reason to drink more water, these type of things. But this is sometimes people will message me, you know, I'm 50 years old and I got acne on my back. What's going on? Your system is improving. Your body is healing. There's some inflammation. Debby, my bad knee swollen and it's a little bit sore. You know, sometimes when you have chronic issues, we can't remember what exercise pain or exercise soreness feels like. And you know, you use this thing, and if it was your thighs or your butt, you'd be like, oh, I did a good workout. But if it's your knee or your forearm or your shoulder, you think something's wrong. You know, it may just be exercise soreness because you haven't exercised those areas in a while. Keep that in mind. If you are super, super sore and you're doing all the right things and what Debby told you, you can use a machine to recover. It's so good at moving lymph. You don't need to suffer through the lactic acid. You don't need no pain, no gain mentality. A lot of my guys and a lot of my hardcore athletes use it to expedite recovery, post-workout recovery. So if you're sore after other activities or using your vibration plate, a minute or 2 will often dissipate it. So it's always your go-to. So I hope that offered a little bit of insight. So let's get to the getting started. Tip 1, yes, you need a stool. I've covered that to a degree. Step 2, Oscillating movement only. Use what you want on your own time, P1, P12, speed whatever, combo this, combo that. As I said earlier in the session, most people have oscillating plates, so I'm trying to speak to the largest audience here. I do not want you starting on a slow speed. It's not about starting slow, it's about starting conservative. And because you have two factors, how fast and how far you're moving, instead of being here and never imagining getting past speed 1, I want you more like here, hip width apart. And I want you bringing it up. I'm going to run, mine's at about speed 30. It's smoother. Think like a bumpy gravel road. When you're driving really slow, everything's bouncing around in the truck, including you. But if you hit the gas, you feel the movement, but you kind of skim across the top. When you're going faster, the body has less correction time to sway and flow. It's got less time to guard and protect and resist. Just relax. Don't fight it. Hold a good position and experiment starting seated. If this is comfortable, you feel cool. My favorite exercise, and I've done a whole video on this, is the sit to stand. Many of my therapists are doing this exercise. What is the sit to stand, Debbie? Well, it's something you probably do 100 to 150 times a day. Every time you stand up and sit back down, you're doing it. But if you stand up out of your chair and you look more like this, and you probably should be working on some leg strength. Now, a sit to stand isn't the easiest thing to start with. I would suggest if you're inactive, you're very, very digressed, you're dealing with a lot of weakness, even perhaps some atrophy or some neuropathy, just start by basically standing. Bend your knees as deep as your body will allow you and as you feel comfortable. Many think that you need a plate that's got big old handles on it because you got poor balance. Well, balance is one of the first things to improve. So I personally prefer a plate design. Many of the older models all had handles. It was how they were moved around. There's lots of reasons. But a plate without a handle, I can add more things to it. I can put chairs in front of it. I can put yoga swings and lifts and punching bags and all kinds of different things that I combine. So I prefer a plate without handles. But if you need something for balance, get yourself a chair back or a ladder or something. So maybe you need something to hang on to start with, but my goal is that eventually you don't. You'll feel stable enough that you don't need that additional, that's in my camera here. So the first place that I want you to start, if you're comfortable standing, is now try pushing a little further into something like a squat. And just hold still. Don't resist it. Don't fight it. If you're feeling it too much in the shins or the knees, the body's very lazy. It always tries to find an easier way to get things done. So it tries to shift your weight forward. So if you feel like you're going this way, or machines with handles, it's easy to hang on and go much lower than your natural range of motion. I'm all about functionality. I don't want you going outside of your range of motion or pushing yourself before you're ready. Just get comfortable with this thing. Get a relationship with this thing. Start moving and feeling better before you get into major structure, like I say. And a squat is the one basic move that I want you all to practice. It's going to be your weight loss. It's going to be your bone density. It's going to be your strength. It's going to be getting up out of that chair without using your hands or as frequently. It's going to be the one exercise that if you do anything is going to have more effect on your body than had you not done a workout. I'll take just the squat. It's not always about a big 10, 15 minute elaborate routine. Okay. So get good at one position. Sometimes the more positions that you add, or if you look up some workout online and there's 12 to 15 moves, it's just intimidating. The word work, it's terrible. So how would I do that on a vertical machine? For those of you that may not have joined me in the beginning, a true vertical machine same. The experience is very different, and it's very, very loud. It doesn't matter where you position your feet, but I still want you functional. So about hip width apart. It's very, very loud. Woo! Okay. What else? So what else should I do on a vibration machine? I want you to, once you have one at home, or if you're still in your research phase, is I really, really want you to consider when you're selecting a machine, what are your plans for use? You know, so it's not always the one with the most bells and the most whistles or the biggest deal. All right, two things I want you to keep in mind. First of all, are you going to be using it in a dedicated space? So maybe you've got a gym in your house and you got a little spot ready to go, and you're disciplined and you're spending time there now. Great. Not everybody does. And many of you, I'm encouraging to use your plate for symptom management. So if you're using your plate commonly throughout the day or more often, or you know, if you're moving it around a lot and you're 90 years old and you don't have anyone helping you out at home, you may want to lean towards a smaller, more compact model. No, they're not the same. A bigger model, a more costly model is probably going to have some upgraded components, better construction quality. The basic movements and the specs are the same, but construction quality is going to vary. The combo machines that have different types of movements, each movement requires its own motor. So on a machine like this that has oscillating, pulsation, and lateral, there's 3 motors under the hood. This thing isn't going to be 12 pounds, and it's not going to be a little compact model that you put under your desk. For those of you that are looking at the ones with the bumps, the therapy bumps, or the little itty bitty 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 ones, again, visualize yourself at home. Okay, so if you're 400 pounds and your thighs are this wide, I don't want you using a machine that doesn't allow you a little bit of room to grow. That might be a good seated use under your desk model, but if you're looking at progressing to any kind of standing or fitness, a good, solid, basic oscillating movement. I don't recommend the ones with therapy bumps long term. If that's going to be your only machine and you want to do lots of exercise, they tend to be smaller. They can be a little tippier. There's no perfect machine for every application. If you're going to be a seated user, you're only using this at your desk, you have no plans of standing, or you're just doing a little of standing, you know, those compact models may fit the bill. The last point is portability. So yes, a smaller, lighter machine is going to be easier to maneuver. It's going to have more portability than something that's got more bells and whistles that's going to weigh 40, 50, 60 pounds. So if you want portability, don't go the smallest unit, but stick with a basic oscillating movement. As I said, you're going to get more bang for your buck. You're still going to get all the benefits you're looking for, but you're the one that's got to show up and do the time. That's really the key to unlocking the benefits with these things, is consistently using the darn things. So a basic machine is going to be simpler to operate. Most of them will, in today's world, have a remote control or an app that you hook it up to. So programming, you know, play with the settings. It really is going to boil down to what feels best for you. The difference with fitness, the osteoporosis, the bone density, some of those exercise benefits, you've got to make sure that you're doing weight-bearing, appropriate exercises. So can I just stand and increase my bones? Yes. But if I want to lose 50, 60 pounds, I probably need to do exercises better tailored to that. If I want these, maybe it's push-ups. You know, there's things that you can do on this plate. You are only limited. I always say this, you're only limited by your imagination and your range of motion. So, you know, really kind of visualize where you're going to be using this. Be realistic. You know, if you're not a workout queen now and you've never seen the inside of a gym and you're 65, you're not going to turn into an exercise guru just because a vibration plate came to your house. And a lot of times, more features and programs, you know, you want to believe that you're going to get more benefits. No, you're just going to intimidate yourself. So learn the basics. good couple of positions in oscillating movement, and move forward. Same goes if maybe you prefer a vertical platform and that's what you've decided you're working with. The moves are universal. Keep it simple, but be consistent and use the darn thing regularly. Okay? I want to get to some questions. There's no way that I can ever cover all of this in 5-6 minutes. I never seem to manage. I want to make sure I covered all my scary stuff. So let me see here. I asked my physical therapist what he thought of vibration plates, and he asked, what is a vibration plate? I was shocked. I'm not actually, for as long as these things have been around, I think sometimes the marketing has been to the detriment of these machines. The medical companies have really never gone out of their way to educate and make understanding how to use these machines simpler. You got a bunch of manufacturers and sites selling these machines out there, and everybody's battling it out over this is better for that one and that one's better for that one, because they really are genuinely trying to help you. But some companies out there, and here's my warning, anytime something like bad, harmful, any of these words come out of the mouth of someone selling either of these type of platforms, they're trying to sell you. In 30 years of research on these machines, there have never been any ill effects other than overexercise or studies that have been set up to have that outcome. Yes, believe it or not, there are studies out there that are done purposely just to get bad outcomes, and that's the way they're designed. So there are people that don't believe vibration is safe. Let's talk about that. ISO guidelines. There's a set of standards out there around vibration and how this equipment would operate. And many of you have shared these articles in my group and all. Oh, this is bad for you because it's going to give you carpal tunnel. Occupational vibration exposure is very, very different than vibration plate exposure. Occupational vibration exposure is exposure to vibration in a workplace environment or in a long-term exposure situation. So you got a tamper and you're hanging on to that thing for 7 to 8 hours a day for 5 days a week for 40 years. The frequency of a tamper is well above typically 100, 150 hertz. It's very high frequency. Truck drivers, sitting in their seat, their spines, they're under this constant movement of their spine is moving up and down on the road as they drive, that they're doing for thousands of miles a day, 8 to 10 hours a day, 6 to 7 days a week. So the big difference between occupational and anything harmful you've ever read about vibration plates out there is misassociation due to terminology. The term whole body vibration plate is relevant in our world, but the term whole body vibration exposure is a big term in the occupational exposure world. So that term whole body vibration, people just, it must be the same thing. Completely different frequencies, completely different durations. You're not doing this for 8 to 10 hours a day, I hope. So that's the big difference. And there is no time. Anybody asking me, how long can I use it a day? How long can you go for a walk? How long can you go for a jog? How long can you go to the gym? It depends what you're doing. If it's fitness and you're applying yourself, you should be fatiguing. You don't just quit because the 2-minute timer went off. For those of you doing symptom management, same thing. Keep your sessions short and use it more often. I'm never going to put a parameter on how long you can use a machine if it's giving you pain relief. If you've overdone it, you might be a little sore the next day, just like over-exercise. I've already explained that. But you're going to have to figure those limits out on your own. There is no risk to doing longer durations. You may risk over-exercising, but this is not an occupational exposure thing. That's discussed in a little bit more detail in my contraindications too. And there is no perfect setting or number for any one benefit. I can't do this for you. I can't learn this information for you. And I'm not going to blow sunshine up your butt and lie to you and say that there's one setting for this benefit or there's there's only one frequency or one workout. It's just not true. But understand, these poor manufacturers are trying to get you to benefit. You didn't buy this thing because you didn't want to gain benefit from it. Most people don't do the research on them until after they've made the decision. So you buy this thing and you see something on the internet. Ooh, don't use that as an excuse not to move forward. Do more digging. And if anyone is offering you, as I said, harmful information, negative information about any type of vibration plate, they're trying to sell you something. Okay, they're not being truthful. But that's their job, right? Okay. Who else do I have here joining me today? Okay, so I know I have Carol. I know I have Vicky. I hope that answered your question, Virginia. And I'm not surprised. There's a lot of therapists that think I'm just bad, poop, crazy. I'm very passionate about what I do, and even the medical professionals I work with that are familiar with vibration plates and lean on me for guidance. I'm not a doctor. I'm not a physical therapist. I just have very, very in-deep, long tenure in this industry, and I've had the very good fortune of working with some of the best surgeons and doctors in the world. They just happen to be vibration plate enthusiasts, and we've supported each other over the years. So Vicky loves her pulsations on her Relaxa-Vibe. I have the Relaxa-Vibe lineal or the pulsation setting. If you do have a combo model, it's nice for massage. If I'm exercising, if I'm looking for functional gains, as I said, I absolutely, hands down, prefer my vertical. I need a beverage for a moment. Or my vertical, oscillating. Oscillating for me is more bang for your buck, and it's just something more people can easily gain access to. In a perfect world, everybody would have like 30 grand to spend, and you could get the best vertical and the best oscillating, and then we could really do some training. But it's not a reality. Who else do I have here? Carol asks, balance. I put a walker I had around my plate just in case. Great peace of mind for balance issues. That's an awesome thing. Walkers are a great thing to use. It's what you're used to using as well. And whether you need to hang on to it or not, it's kind of this mental thing. You feel safer. I have a lady in Calgary with very, very severe MS, very progressive, and her husband has built, it's beautiful. It's got like wood spindles and it's varnished, and it's like a little balcony. So she's got a ramp where she walks up to her plate. It's got this little wood balcony with railings all the way around it. So she always feels whichever way she wants to go. If she wants to get this foot off or step forward, you're only limited by your range of motion, your imagination, and in her case, her husband's building skills. So good for you for experimenting. That's a great idea. And I'm hoping you need it less and less, that walker. Lisa says, please repeat the initial starting speed you mentioned. I recommend a mid-speed range. So if you're using an oscillating plate, there is no universal set of speeds or programs, but the one I'm using today had 60 levels. So I like you starting with a closer foot placement. There's another half of the equation I'm driving home today. It's not just the speed, it's your foot position, especially in oscillating. So feet are hip width apart or closer, and I recommend a mid starting point. If your machine's got like 99 or 100 speeds, the 50 range, 40 to 60. The reason I speak in ranges is I'm encouraging you to be creatures of habit and keep your positions the same, and just play with your settings a little bit from week to week to keep the muscles challenged and progressing. So start there and see what feels comfortable to you. The slower you go, the more choppy, destabilizing, the more balance. The faster you go, the more challenging, because your muscles are having to keep up with more movements per second. You may need to bring your feet closer and closer if you want to go faster. It's a balance between the equation of the two. So experiment with that if you haven't already, Carol. Or that was Lisa, sorry. Angie says hi. Hi, Ange, how are you? Hopefully it's not snowing there. Ange says, can you explain to people if they'll get enough benefit from just standing on it, how easy it is and how much more beneficial it is to perform simple movements? Yeah, that's a good, I talked on that, but I rambled off on a few tangents. You certainly can just stand on a machine. I'm not here to say what you have to do, but I think when people ask me, and please don't take this the wrong way for those of you that have asked me, when people ask, is it okay to just stand on a machine? That just tells me, you're asking is, do I really have to work? Do I have to put any effort into it? No, you don't. But your effort is going to equal your results, just like at the gym. So you could go to the gym and you can just walk on that treadmill. Absolutely, you're going to get a lot of benefits. But are you going to get different benefits if you run on it, or if you add an incline to it, or if you pick up a set of hand weights while you're walking? So it's a depends. You absolutely can stand. What benefits are you looking to achieve? If you're looking to increase lymph and circulation, yeah, that's probably all you need to do.